UMMC.com. We are glad to welcome in our first guests this morning from the University of Mississippi Medical Center, UMMC, Dr. LouAnn Woodward, who is Vice Chancellor for Health Affairs and Dean of the School of Medicine, and Dr. Alan Jones as well, Associate Vice Chancellor of Health Affairs at UMMC. Good morning to you both. Thanks for coming in.
Good morning. We're glad to be here.
You needed an extra layer this morning when you walked outside. we got that weather change. Felt really good.
Felt like finally fall.
Absolutely. Well, what it's supposed to feel like in late November. Really appreciate you coming in this morning. I'd love for us to start really big picture. And I was thinking, so my wife and I were in Jackson for a year when she was in pharmacy school. That feels like a long time ago, but not quite 20 years. But thinking about the changes at UMMC in the last 20 years, it's almost as if it is a completely different place.
It really is. It really is. So I graduated from medical school there. Actually, Dr. Jones and I both graduated from medical school there. I was a little bit ahead of him, and it was a little bit more than 20 years ago. But it is so interesting because when I talk to people that I either went to med school with or did my residency with, and they have not been back to the campus since we graduated. And really? I graduated from med school in 91 and finished my residency in 95. You know, they come back and they are disoriented. They literally feel like I cannot find my way around. There has been such growth over these last, 20 plus years. And it's really exciting. And what we constantly think about when we're thinking about growth and areas that need to grow is what are the needs in Mississippi, whether it's related to workforce needs and our education programs and the growth that we've seen there and that we're still experiencing in all of our education programs. Mm-hmm. Growth in our research mission. We had just a record year last year, actually, and brought in close to $120 million of federal funds into the state through the medical center research programs. And then certainly probably what's most obvious to people all around the state is the growth in our clinical programs. But it's really remarkable. I think that the campus is just beautiful, honestly, that we've tried to make it something that everybody in Mississippi can be proud of. We've grown a lot there on the campus as well as off campus and even across the state. So it's certainly been fun. It's been a lot of fun.
Actually, I'm glad you said what you did about the beauty of it and something that people can be proud of, because I get that could be a little superfluous or whatever, but if a building is ugly and looks uninviting, you're like, eh. When you see, and I'm just using as an example, the Sanderson Tower at Children's of Mississippi, and you drive by, literally, the first time I drove by that, I was like, wow, it looks like a university hospital in cities across the country that not only are you proud of, but it's like you look at the building and you're almost like, man, I bet there's good stuff that happens in there.
That's right.
I know that's kind of surface level and maybe a little silly, but I think people look at it and see that.
I think that matters. The way, just like the way you present yourself as an individual, the way that the campus is presented, the facilities, the grounds, it matters. And we talk a lot about that, how the little things really matter. If you see some trash on the side or out in the hallway or even out in the grass, pick it up. Things like, yeah, I know it sounds simple, but things like that matter. I think it does matter how you present yourself. Now, what matters even more is that inside those buildings, we have high quality care. So, I don't want it to sound like it's all about how something looks from the outside, because that's not true. We are as focused as much or even more on the high quality care that is delivered. But it also matters, I think, what the campus looks like, and is it inviting, and does it look like people care?
Yeah. Dr. Jones, one of the things that is really growing, and it seems like there's a focus on right now, is this Cancer Research Institute, Cancer Center and Research Institute within the hospital. And I guess it was a press release or a story that I was reading about, Mississippi and Arkansas and Louisiana not having an NCI designated cancer hospital, and a very focused drive to get to that point, which is really interesting. I don't know that this is apples to apples, but I grew up in Oxford, and I remember when Robert Kyatt was named Chancellor at Ole Miss, one of the things, he set a goal for a Phi Beta Kappa chapter at Ole Miss, and he said, for us to get to that point, this, and this have to happen. They've got to happen in this order, and then he went about the task of getting to that point. Is that similar when you talk about designation from the National Cancer Institutes?
It is. That is a very similar comparison. When we think about organized cancer care, most people that lived in a big city or live in bigger places know that there are oftentimes multiple NCI, National Cancer Institute, designated cancer centers in a state or in a city. Some big cities like Atlanta may have a couple within the city. Not having one in the area of Arkansas, Louisiana, Mississippi is a big disservice to the people that live in those areas, because what NCI does is it opens the doors to various types of therapies that might not otherwise be available to patients that live within that geographic area. So you are essentially saying we have achieved a certain level of research funding, a certain multidisciplinary level of clinical care, and a certain level of cancer education. And through demonstrating those things, the NCI and others will then give you access to clinical trials and other types of therapies that otherwise are not available. And so you probably have friends or have heard of people that, say, leave the state and go to MD Anderson or Vanderbilt or UAB to seek a second opinion or to seek cancer care. And what they're really doing is their oncologist or their local provider has said, really what we would do here is not necessarily adequate. And so we want you to go to this place because they may have access to a clinical trial or a different therapy that we don't have access to, and that might be beneficial to you. So we want to bring that to the citizens of Mississippi. We feel like it is ethically UMMC's responsibility to bring that into the state and to allow those options for all of Mississippians.
I want to interject and tell you, you're doing an amazing job. My father is dealing with exactly what you just discussed, and your doctors, the people, UMMC, nailed it, just exactly what you're saying. So I want to commend you. You're not just saying something, you're doing it.
Thank you.
We feel like it's something that nobody else in the state can do. Only UMMC can do this because it does require kind of our three core missions to accomplish it. And we feel like it is ethically our responsibility for the citizens and moving into the future that we go after this.
Yeah, it's interesting to hear you say that. We've only got about a minute into the break, and if you guys are good, we'll carry over and continue the conversation on the other side in just a second. But you made the point about MD Anderson. How many people do you know who they get a cancer diagnosis, and what do you do? Well, we're headed to Houston. Mm-hmm. And then I feel like we've gotten to a point where maybe there's an initial visit there, but then for their treatments, they're staying home. They're not necessarily going back and forth. Is this a step in the direction of getting people comfortable with saying, I got this diagnosis, I'm going to Jackson, to UMMC, as opposed to I'm going to Houston or Nashville or Birmingham, as you said? Absolutely.
Very frequently we get calls from patients who have been to MD Anderson, and the doctors there say, UMC offers this. We have a very new specific therapy called CAR T therapy, and we have patients referred back from MD Anderson into our program because it's better for the patient and their families if they can get that care locally. So absolutely, we've already put building blocks in place to offer this type of therapy.
We've got more coming up with Dr. LouAnn Woodward, who is Dean of the School of Medicine at UMMC, and Dr. Alan Jones, Vice Chancellor for Health Affairs. This is the Gallo Radio Show on SuperTalk Mississippi. Quick time out. More with you coming up as we roll along on this Thursday morning. This is the Gallo Radio Show on SuperTalk, Mississippi. Thanks for being with us on this Thursday morning. Continuing our conversation this morning with Doctors LouAnn Woodward and Alan Jones, both from UMMC. And before we tackle the really fun stuff of the legislative session and what you guys need, what you're asking for, Lance wanted to jump back in with one more thing.
Well, it was not me. I wanted to, again, say that these guys are amazing, and they had a couple more items regarding cancer that they wanted to discuss.
Yeah, no, let's absolutely continue that conversation. And then, so we were talking about MD Anderson, which is generally focused on adults. As a jumping off point and kind of go the direction you guys want to go, what about with pediatric cancer? The things that are happening at Children's of Mississippi, the things that kind of the coverage radius in terms of where patients are coming from?
Yes. So, if you've been paying attention to the medical center for the last 7 or 8 years, you know that we've had a real focus on pediatrics, pediatric services, pediatric expertise. We built the Sanderson Tower, working to expand our capabilities both here in Jackson and on the campus, but also to reach out and work with pediatricians and hospitals and health systems all around the state to support their pediatric efforts. So in a lot of our clinical services, pediatrics is a little bit ahead of the adult services. So, and true to form, in late August or early September, I think it was, we actually had a ribbon cutting for our newly renovated and expanded children's cancer clinic. So, lots of good things are happening there. It's a beautiful facility again. It's wonderful. We're so happy to have it. We had lots of philanthropic support for this. And we take care of patients from all across the state. So in our pediatric world as well as in our adult services, we view our community, if that's the right word, as the entire state. And we see patients from all 82 counties, every single day. When you look at cancer outcomes and look at it as a nation, you would see that Mississippi is, in fact, the worst. We have the worst cancer outcomes in the country. And there are even some areas of the state, particularly the Delta, and some subpopulations when you kind of drill down from our overall citizen population. There are some populations whose cancer outcomes are some of the worst in the world, not just the state or the country.
So it's not necessarily that more people in Mississippi are getting cancer. It's when those diagnoses happen, they are not getting the care they need because of a number of factors, right?
There are so many factors that go into this, and some of it is prevention and screening and early diagnosis that impacts overall outcomes. Some of it is access to care. So there's not just one issue that if we could fix that one issue, suddenly we'd have the problem solved. But part of this is to achieve that NCI cancer designation. You were talking about making the trip to MD Anderson. My mother passed away of cancer, and before she passed away, we also, made that trip out to Houston, got on I-20 and, drove to Houston. And true enough, when we got there, they said she was being treated at the medical center and she received great treatment. And they said, all the options that we have, you have already addressed. They didn't have anything new, but it was that desire to have that sort of super specialist and, that exclusive club, the club that we're currently not in Mississippi, and that's the NCI cancer designation. But you think about, there are so many Mississippians that cannot. They don't have the means. They don't have the transportation. Sure. Making a trip to MD Anderson or Vanderbilt or UAB or Mayo Clinic or one of these other out-of-state NCI designated centers is not an option for them at all. So we want to have the option here in Mississippi for all of our patients.
I mean, it's hard for some of these people to even get to Jackson, much less out of the state.
So I wanted to ask you about this because this is something that I've heard, and I just would appreciate verification. We're in North Mississippi, and obviously St. Jude is an amazing place, and what the work that they do there is incredible, and Le Bonheur as well. But there are lots of people that think or have thought through the years that, hey, to get the treatment that is available at St. Jude, I got to go to Memphis, as opposed to maybe not understanding that St. Jude, with a lot of the research they do, they share protocols. And so you can go to Children's of Mississippi and get the exact same treatment here in the state of Mississippi and not feel like you've got to go to St. Jude or to Vanderbilt Children's or where. And that's not to denigrate those places at all, but just to make people aware that's here also.
Yeah, the way a lot of those clinically oriented trials work is they're done at multiple places, that, because there's not enough patients if you just did it at one site. So they're usually nationwide, and they open it up to these centers that have NCI designation. Yeah, really good stuff. As we go toward this legislative session, a blank check would be nice, right? If you could say to the legislature, hey, we want to spend on this and this and this, and it's infrastructure and it's patient care and it's, bringing on more staff. But we know that it doesn't work that way. Where are your priorities right now in terms of what you need from the state of Mississippi?
So I would love to, the blank check option, I would love to have that. But, in
the absence of that.
In the absence of that, I do want to say, and I think people recognize, we certainly talk about it a lot at the medical center, the legislature has supported us so well over these last 15, 20 years that you're talking about all this growth. Whether you think about the School of Medicine Education building that we opened in 2017, the clinical trials unit, actually, that we have for cancer patients within our hospital, the School of Nursing and School of Dentistry buildings that are currently under construction. These are all buildings where the state supported us, and they supported us. They were a component of the support that we got for the Sanderson Tower. So we have had great support from the state. They have definitely been partners with us in this growth and this expansion, and really being able to look statewide, what do we need, and helping us in the citizens, support the citizens of Mississippi. So that has been very important, and we're very thankful for that. They are wonderful partners for us. So this year, as we're going into the legislative session, there are a lot of healthcare topics that will be, discussed and will be important priorities. We are working with a number of different folks on everything from things like CON to the trauma fund to how hospitals are taxed to pay the state match for the Medicaid federal dollars. It's a whole list of things that are out there that are important to hospitals and health systems and health care in general. In the last year or so, we worked with the governor and the governor's staff on developing this MHAP program, which has been very, very good and very helpful to hospitals. Last year, the legislature, the House and the Senate, came pretty close to working on a model for Medicaid expansion. In the end, they didn't get it across the finish line. And we are certainly hopeful and will be supportive this year of efforts toward increasing access to patients to health care, whether you call that Medicaid expansion, whether you call it some version of expansion with a state health exchange that might be layered on top of that. There are lots of different options and ways to look at it, but that, I think, would be very impactful and helpful to the patients. The MHAP funds have been very helpful and probably even life-saving in a way to hospitals across the state, and that has helped kind of stabilize the infrastructure. And this year we're hoping to be working with the legislature as they hopefully get something across the finish line that will improve access to care for some of our Mississippians that just don't have that right now.
And this has been the topic of conversation for a long time, right? Did this past year feel like it was closer than it had ever been in terms of, hey, getting this enacted, getting it, Dr. Woodward, as you phrased it, across the finish line?
It did. It felt like people were at least talking about it openly and having some debates. And when you get down to some of the particular facets of it, components of it that the House and the Senate were arguing back and forth, from my perspective, I feel like that's the law. Y'all are the politicians. You're the legislators. You make the law. From my standpoint on being on the healthcare side, I just can't say enough. anything that gets more patients access for all the reasons is positive and is the right thing to do. But I was very encouraged last session that there was much more conversation and much more open conversation. It's still a topic that people have mixed opinions and mixed emotions on, and I get that. But it was good to see that there was a different kind of open dialogue last session than we've had before.
And if you tie that back to cancer, we know that patients that enter the care paradigm for whatever it is early in the process, they have better outcomes. So patients who have some type of program that, like Medicaid or a private insurance program, some type of coverage program, we know they'll enter the healthcare system sooner. Because they have access to, those primary care doctors and others.
Quick time out. We're back right after this Gallo Radio Show, SuperTalk, Mississippi. Morning. There's nothing like having guests in and not telling them that you're going to ask them to stay for a couple of extra segments. Have no idea what their schedule is the rest of the day, and hey, you just assume that they'll be able to make it work. So thanks to both of you, Dr. LouAnn Woodward and Dr. Alan Jones, for the conversation this morning. I don't know which of the two of you this is better for, so feel free to go any direction that you would like. I would like to talk about the medical school itself. The doctors that are coming out of med school at UMMC, I feel like overwhelmingly are staying and are practicing in the state of Mississippi. Now, many of them are going elsewhere for fellowships or maybe to do a residency, but largely are coming back.
You're right. You're right.
How is it that
Dr. Woodward's about to put on her preacher hat here?
Well, and I guess what I was getting at is I know the majority of the medical students are from Mississippi, but when we hear about brain drain all the time, right? Some of our best and brightest who are finishing college and then they leave the state of Mississippi. And yet that doesn't feel like it's happening within our medical community nearly as much. How is that happening?
So a couple of things. We are awfully proud of our retention rate of our graduates to practice in the state. But, we stacked the deck from the beginning. So you said the majority of the class were from Mississippi, but the truth is that 100%
okay, it's exclusive.
Of the medical school class, they are Mississippians. So we stacked the deck to begin with. And there's no requirement from the legislature or from anybody else that says you have to only take Mississippians. But we do that because we want to have our graduates, whether they get part of their training out of the state or whether they stay here for training, we want them to ultimately practice in Mississippi. And part of that is you look at the workforce, the physician workforce around the country, and we are the lowest or next to the bottom in physicians per capita. So perhaps 15 years from now, they won't have that requirement for 100% Mississippians, but right now we feel like it's the right strategy. Yeah. Also, supporting that retention rate and helping in that way is the Mississippi Rural Physician Scholarship Program that the legislature started about a decade ago. That has been a tremendous component of our ability to retain folks to practice in our state.
What are the details of that?
So the students that enroll in that program, and now it's also open for dental students as well, so it's medical and dental students, they get a scholarship that pays for medical school, and on the back side of it, the commitment is that they remain in the state once they finish their training. They could still leave the state and go get their residency or fellowship training, sure. But once they're done with their training, then they have to come back to Mississippi and practice in the state and practice in one of our rural communities.
Really interesting stuff. One of the things that's fascinating to me, and I'm kind of at that age where people, even though it's a long commitment to go all the way through med school and through a residency program and through a fellowship, people they've made it all the way through, and now they're practicing and they're successful. But even going back to when I was an undergrad, there are doctors now who are choosing to stay and go to med school at UMMC that could have gone anywhere they wanted to. They could have gone to Vanderbilt. They could have gone to NYU. They could have gone to Harvard if they had wanted to, but they chose to stay here.
Absolutely.
And as good as students as some of those were, that doesn't happen if the med school is not one, competitive, and two, producing really good doctors. And so, I mean, regionally, some of the best doctors you'll find are practicing right here in the state of Mississippi.
Absolutely. And,
No doubt.
and you know, the students are so sophisticated these days. They're so smart. They look at things like graduation rates of med schools and residency match rates. So the graduating seniors, do they get the residency match that they want? And we beat the national statistics in those kind of outcomes. So, you know, we limit our selection criteria to just Mississippi residents. But let me tell you, when they finish this program, they have finished a very strong program, and they are competitive to go anywhere.
And they're prepared.
They are prepared.
Yeah. Dr. Jones, what is the balance when you talk about the hospital as a whole, University of Mississippi Medical Center, and this is a teaching hospital because it is a university hospital versus this is a hospital that is here for care of patients? And I'll do what a journalism teacher told me to do. It's a two-part question. How does it work with professors who are teaching and mentoring students but are also providing care?
Yeah, that's a great question. Well, you know, first of all, everything that we do, we try to focus on the patients. We focus on patient care, what is best for our patients, and then how do we deliver the highest quality patient-centered care that we can. All of our faculty physicians that practice medicine, you know, they also have other responsibilities within an academic medical center. They teach. Some of them teach in the classroom. Some of them just teach at the bedside. But these are unique individuals that when they finish their training, they want an environment where they don't just see patients, but they also contribute in a way where they are able to teach residents, medical students, or they do research, and their research in some way contributes to the care of the patient. So anybody that's been to UMMC or knows somebody that's been to UMMC knows that when you're in our hospital or in one of our clinics, you're going to have a whole host of people standing around looking at you, thinking about your problems. Yeah. And those are the physician, the attending physician that's directing the care. Those are residents who are learning, you know, and a lot of times actually providing most of the hands-on care with direction. And then there are students, nursing students, pharmacy students, medical students that are there to learn about how to then become a resident or how to become a nurse. And, you know, that environment is really something amazing to see because it gives a patient a sense of confidence that, hey, you know, I don't have just one person thinking about me. I got all these people thinking about me. And they are, you know, more coddled in a way because, you know, these students are always checking in on them. The residents, you know, want to do the best job that they can. So it's a really unique environment to receive care in an academic medical center.
I want a story from both of you as we wrap things up to humanize this a little bit, because both of you have taught. You've been in the academic setting. You've worked with residents, with students in that setting. I want a story about a time where you saw a young resident or even still a medical student see something or do something and it hit you like they're going to be a great doctor. And then I want a story about a kid, I'm using that term loosely, that you saw that you're like, they got no shot. And then they surprised even you.
So I'll start with the story with a student actually. So, and I was working in the emergency department. Actually, he and I are both emergency medicine physicians, and in our roles for many, many years, taking care of patients there at the medical center in the emergency department. We worked with residents, we worked with med students, we worked with paramedic students, we worked with nursing students, you know, all the different students that you might imagine would be there in the emergency department. And so in the first couple of years of medical school, you learn all the chemistry and the science behind diseases. But I had a student with me one day, and we walked into a patient's room, and the patient had what is called DKA, which is a a diabetic ketoacidosis. It's a diabetic patient whose sugar has gotten very high, and they're in this state of being confused, and their vital signs are out of kilter. And one of the things that they do is they breathe very fast. And actually, there is an odor to the breath because their body is trying to burn up all this sugar, and there's a certain smell that you can smell. So we walked in the room, and just right off the bat, I knew what this patient had. We didn't have any lab tests back. We didn't have anything. The patient had just rolled in the door. But looking at the patient, you could see that the patient's breathing too fast. They're a little bit sweaty. They're confused. You feel the pulse. It's too fast. All the signs are there. We don't have any data yet, but we have the patient right in front of us.
Sure.
So I bring that student in with me, and I said, let's talk to this patient and let's see if we can tell what's going on. So the student, is a little bit confused at first, but the fun part, the part that is just so thrilling as a physician in an academic medical center is, as we were both standing there at that bedside without even a finger stick glucose to tell us what the patient had, the student started putting the pieces together, and it's almost like you could see in their mind
they recognize
these things from their biochemistry class and from their preclinical classes. All of a sudden, the student looked at me with just big eyes and said, "He's in DKA." And those are the moments that are just you kind of just have a little mini celebration inside, because it's like they get it. They've put all these pieces together. That is a beautiful thing to see.
I said both of you stories, but we ran out of time. She took all your time, Dr. Jones.
That's all right.
So we will stop it there. Really appreciate both of you coming in this morning. Dr. LouAnn Woodward, Dean of the School of Medicine at UMMC, and Dr. Alan Jones, Vice Chancellor for Health Affairs. Hope you both have a great holiday season. Thanks for joining us.
Thank you.
Great to be here. Thank you, Richard.
Thank you.
We'll take a quick time out, wrap up the 7 o'clock hour next. Really enjoyed that conversation. This is the Gallo Radio Show on SuperTalk Mississippi.